For the next few weeks, Dr. Sessa will be going into depth on the topic of cosmetic breast surgery. He is here today to talk about breast augmentation. Welcome back, Doctor.
Thank you. Thanks for
So we're
being
going to start the show with talking about what happens to our breast after childbirth.
So I see a lot of women for cosmetic breast surgery, and one of the main questions that I see, I hear a lot, is in regards to childbearing and how long after and so on and so forth can they have surgery. So I'd like to just take a step back and just talk a little bit about what happens to your breasts during when you get pregnant and when you have your child. So, you know, when you get pregnant, you know, we have all these rush of hormones in our body that cause our breast to expand. It's a natural process, and it's a process that all women can look forward to, because I also hear, as an aside, I just want my breasts to go back to the size that they were. So when I was pregnant, not before I was pregnant. So the glandular tissue in your breast will hypertrophy and will expand in order to produce milk. And during that time, that's when your breasts will become engorged and enlarged. So as far as once you have the child and all of the hormones that were expanding your breast are now gone, now your breast starts to involute. It starts to decrease in size. All of the glands that were necessary to produce milk are now gone or shrinking. So what women all notice immediately is that the skin doesn't contract as quickly as the breast does. So unfortunately, we're left with a loose skin envelope, possibly stretch marks, and a smaller breast, maybe even a flat breast, and that what sort of, in and of itself, gets women to sort of come and see me.
Sure. So what do you recommend, and how soon after childbirth can someone receive breast augmentation?
So generally I tell people to wait at least 3 months, sometimes up to 6 months, after you've finished breastfeeding your child. Because if you're continuing to breastfeed, those hormones that are allowing your breast to produce milk and hypertrophy your glands are still in your body while the baby is still suckling. So once that stops and the baby is taken off of that and your breast is left to sit, your breast will involute fairly quickly, within the first month to 6 weeks generally. But you still may be able to express some milk from your nipple even up to 2 months afterwards. So we want that to pretty much stop, because we want to know if your breast is still somewhat enlarged and we put an implant in and then it still decreases in size, the result won't be what you were expecting. So I like to wait 3 to 6 months after you've finished breastfeeding your child to get the most accurate.
Now, before you become pregnant, is it safe to have implants? Or?
Oh, yeah.
Okay.
So, you know, the implants are foreign bodies. However, the implant is placed beneath your breast gland and also beneath the muscle below your breast gland. So if you look at, you know, anatomically, there are your ribs. Then above your ribs is your pectoralis muscle, which is the large muscle in your chest. Above that is a layer of fascia, very tight, that covers the muscle. Above that is a sort of loose, what we call areolar tissue, and then above that is your breast gland. So there's multiple layers. Generally, implants are placed in the loose areolar tissue below your gland or under the muscle. So those are the two places that I place them. Most often I place them under the muscle, because I think that it just gives a very natural look to the implant, as well as it's more protective to the implant. So as far as are implants safe, they are anatomically separated from your breast gland. And whether you get saline or silicone, they're not going to go into and around they're sealed, and the way that the silicone is made now, it's very, very cohesive. So most, if not all, silicone implants now are almost like Jell-O. So even if you were to cut them or if it were to tear open, it's not going to leak out, and it's not going to get into the breast milk. So implants are safe before. They're not going to affect if you did have implants, got pregnant, and were breastfeeding. It's not an issue.
Okay. And you can talk to your patients when they come in to decide whether they want to go possibly a bit larger than they were before they had children.
Yeah.
So it all depends on the individual, and that would be the time to come in and do it, though, is the 6 months after.
Yeah,
Okay.
exactly. So the way that I like to do it, and I'll get into this a little bit more with some future segments, but I like the women to actually try on the implants because I like them to see what they're going to get, not that they have no idea what they're going to receive,
Right.
and it's just a surprise when they wake up after the surgery's over,
Sure.
how much I actually put in.
Yeah.
So I generally I take measurements beforehand because implants are exacting, but they're not very exacting
Okay.
in terms of this is an object that will fit, but for a large woman
Right.
that has broad chest,
Right.
that size implant is going to look very different than a small petite woman.
Absolutely.
So trying the implants on is very, very important as far as what they're going to see.
All right. And we'll talk more about that, like you said, in upcoming segments.
Okay, great.
Thanks for being here today.
Thank you.
Tune in next week for another episode on cosmetic breast surgery with Dr. Sessa. We'll be right back with more tips on how to age gracefully. We welcome back Dr. Terry Dees to continue our discussion on weight loss and how the customized weight loss program can help you keep weight off. Thank you for being back. Nice to see you again.
Nice to see you. Thank you for having me back.
Great. It's always good to start with a little foundation again. So can you tell us how you got started with your customized weight loss program?
Absolutely. Well, I've been in practice for 16 years, and I'm a natural health physician, so our focus has been clinical nutrition, functional medicine, chiropractic and rehabilitation, and my passion has always been weight loss. We ran a program over the last number of years where we always help people with getting healthier and doing it for the right reasons, for long-term health benefits. Because you know, when people are just trying to get healthy to look better in a bikini or something
Right.
like that, it gets hard to maintain it for the long term.
Yeah.
And we've really focused in on our customized weight loss plan over the last year.
Okay. Now, it's about making small life changes and gradual things. Can you give us an example of what someone's customized program might look like?
Absolutely. So a typical patient for us is someone who's done a big box plan in the past. They've lost some weight, they've gained it all back. It's someone that wants to lose the weight quickly, naturally, in a very healthy way, and learn how to reset their metabolism to maintain it for the long term. So it's funny because people will call my office and speak to my assistant and say, well, can you tell me about the details of the program and how it works? And it truly is customized for each person, because what you might need for your health is completely different from what the next person needs. So we focus on whole food nutrition. We sit down knee to knee, eye to eye, and figure out where they are with their health, what high-grade nutraceuticals would benefit them to help support their body systems, to put their health in the best position possible, to help their body burn fat in the fastest way, the healthiest way. And we average men typically lose about a pound a day, and women lose anywhere about half a pound to a pound a day.
That's amazing.
It's incredible.
That's amazing.
And our demographic we work with most commonly is 65 to 85. So we're doing this with people, you know, not 30-year-olds that have super high revved metabolisms and great hormones. So we're addressing hormonal issues, we're addressing metabolism issues, we're addressing thyroid, we're addressing detox, and we're creating a custom plan to help those people without drugs, without surgery, without exercise, get to a better level of health. And then I think it's as important for people to get the weight off as it is to learn how to reset their metabolism to keep it off.
Absolutely.
Because especially as you get older, the more you yo-yo up and down with your weight, the harder it becomes on your health.
Absolutely. There's a lot of health problems that it causes, I know. I've been there, and I think we've both talked about it, that we've both lost a significant amount of weight. And that's not anything that you want to see as we grow older.
Oh, yeah. And it's hard on you emotionally, too. If you've lost the weight and you got back into the little clothes and then all of a sudden you're creeping up your sizes of clothes, you know, we build into our program a back end of lifetime support. So if things start to go south, you know, I tell our patients, you gain back 5 to 10 pounds, you call me right away.
Absolutely.
And we'll have a come to Jesus meeting and we'll figure out how to course correct. Because 5 to 10, if you catch it, you can course correct. It starts going 15, 20, 25, 30. We have people, you know, 60, 70. Well, then we got to start over from the beginning. And that gets tougher and tougher as you get older.
It does. Now, is there anything on your program that someone is not allowed to have?
Yeah, and that varies from person to person. So, you know, it truly is customized of how we set things out. And knowing where people start with their health, what they've got going on, really helps a lot to customize that plan for every person. So, you know, there are probably 80% of people fall into a typical plan, but there's always those exceptions that we have to, you know, work with to help them get the results that they want to get.
Okay, so again, now, for example, I enjoy a glass of wine. Is it something that I can have on the program, or is it something that maybe later on in the program I can incorporate back into it?
That's an excellent question. I find in this part of Florida, wine is like an extra food group. You know? So that's a question we get a lot from people. Typically, I give people the lowest sugar cocktail that you can make that won't you know, affect your metabolism and keeps your insulin very stable. So initially, when we're trying to, we call it a rehab phase, trying to really lose the weight, that we limit the alcohol in that phase. But as we move on to the later stages is where we can introduce, so that eventually we get to the point for people when they're in a maintenance phase, that 80% of the time they're eating a healthy diet, 20% of the time they're enjoying their life with food. So they have that as a flexibility.
Okay, so that's basically how you help people incorporate into how to keep the weight off once they've lost it.
Exactly. Yes, we do a structured plan to get the weight off and can do it very quickly, very healthy, and then teach how to maintain and reintroduce so you don't regain.
Okay, and I understand you have another success story that you'd like to share with us today.
This is a lady, Lori, that we worked with. Great lady, you know, busy in the workforce and didn't have a lot of extra time to pour into training and different things to try and get fit. She lost almost 20 pounds in 40 days, a huge amount of body fat. You can just tell in her photos that just the definition that came back was great. And we did it without exercise. 80% of your fitness is nutrition. And she's done phenomenally well. And her friends and her coworkers are just dazzled by her success. And we're
I'm sure
super proud of her.
Very inspiring. Very inspiring story. Now, you have something special for our viewers again today. Tell us about what this special offer is.
Yes, we want to give the viewers an opportunity that if you want to sit down to have a conversation about if our program could be a good fit for you, we want to give you that opportunity to do that. So we're going to give a chance for the first 20 callers. We did you know, more than that in the past, but we're very busy, so I have to limit down the number. But the first 20 callers that we do a free, no obligation consultation.
Okay, that's great. Please take advantage of this. If you've ever wondered what the customized weight loss program is, this is the time to do it. So thank you so much for being here again. Nice to see you as always.
Nice to see you.
Rachel Tumim from Advanced Acupuncture is here today to talk about classical feng shui. Welcome back.
Thank you so much.
This has always fascinated me, so I'm looking forward to our segment today. So tell us, what is classical feng shui?
Well, feng shui, it's a discipline, part of Chinese medicine. It was developed at the same time as acupuncture, so it's thousands of years old, and it's really about, each one of us is born with sort of a magnetic signature. In feng shui, we call that a Minggua, but it's just about how our magnetism relates to that magnetism that is the earth, because the earth is this giant magnet, right? And we have blood, which has iron in it, so we're very susceptible to magnetic energies, and at our birth we're sort of lined up in a certain direction, and for feng shui we're looking at how do we best align ourselves with the most auspicious energies we can.
Okay, now how did you become interested in practicing and studying this in addition to your acupuncture?
Well, I had the opportunity to study with a true master teacher. And one of the things that happened during class is that we did an analysis of a local woman's home. And now, my teacher had come from overseas. He knew nothing about her. We were not given any information. We showed up, we did the process, the analysis, everything about the landscape, the other buildings around her home, her pool, how the home was designed. And from there, he was able to describe quite specifically ill health problems she was having, financial issues she was having, family issues she was having, and really from not knowing her at all. And for me as an acupuncturist, I was really struck by that, because if she'd come to me for treatment and I worked diligently on these health issues, but she went back to this home that recreated the problem, I'd be going, well, why isn't this working? But so it became really clear to me that I needed to include this in my repertoire.
It's amazing, just you saying that, how one thing is tied to the other, as is in all things.
Really,
They're all connected.
it's a very well-rounded discipline.
Okay.
Yeah.
Now, how many different types of practices of feng shui are there?
Well, there are a lot of different theories in feng shui. And my teacher taught us all of the classical methods, so it's a very well-rounded form of feng shui. There's also a modern form of feng shui that was developed just in the 1980s, and so it's not really based on the ancient texts and the classical formulas as have been practiced over thousands of years. So I do the classical form.
Okay, and how, when you go into somebody's home now, which you've been doing.
Yes.
How do you begin to measure all the energy in their space and map this out for them?
Well, the most important tool in feng shui really is what we call a low pan. So this is a compass, and all of these different rings around the compass tell me different things about the energies, and I can also use this to focus how I would like this person to face their bed or their desk or something to anchor them into a more auspicious energy in their home.
Okay, so when you go into someone's home with this, do you set it on their bed or a table? I mean, how do you begin the process?
Oh, so, well, what I do is I hold it and I measure against the front door to see which direction the energies are feeding into the home.
Is that because there's a compass here in
Yes,
the center that does that?
The compass is all important. I'm going to line that up and find out what direction we're facing, and I'm going to find out what their Minggua is, so I know how to work within that space to best support their energies.
Okay, so once you go into somebody's home, and we talked a little bit earlier, you know, if somebody owns an existing home and you go in and you say, well, the house is facing wrong, what do you do? How do you work with them then?
Well, there are different things you can do. Now, some of them are more expensive than others. For instance, you can angle the door of an office or a home. So if you change the angle of the door a little bit, which involves construction, or if we come in before as something's being built, then we can set it up that way. The other thing we can do is look at how we place the furniture in the room. So the angle of a bed, the angle of a desk is going to amplify certain energies. And for instance, this angle, I measured it before we got started, and I know that this is a really auspicious direction for me to face. And actually it's set up so that I get that energy to come to me more quickly. Now, I don't know which direction you're facing and I don't know your mingua, but we could say, for instance, well, that direction might be a direction that brings you fame and success. But if I sat there, maybe I get the same thing. Maybe I get not so much fame, maybe just peace and stability. Maybe I get conflicts and ill health. So it's different for each person.
Everybody. Okay. So back to the house space. So if you are in a space and you can't change your doors, there's a lot of different things that you can go in and do inside, but you also talked about outside. If there's
Yes. So there are certain landscape formations. You can add a pond and a stream, different things, and those are highly complex formulas. In fact, there are a lot of feng shui masters that don't even do it because they're very, very complex. But I have learned those formulas, and I can do those water formations or change the direction perhaps of how the pathway or the driveway comes in. We can, again, the certainly colors and materials within the house, but those are less powerful than things that we can do outside.
Okay.
But there's always something you can do.
Always something you can do, and you can start very simply by contacting you, because what do you do when you do an analysis, Rachel? If you can give us a quick overview of that.
Sure. The first thing we do is find out what the intentions are. What is it that you're wanting to amplify in your life? Is it health? Is it wealth? Is it both? And then I'm going to get your birth information so I know what your mingua is and I can understand how the energies are going to affect you. And then I come in, I look at the floor plan, I measure your door, I find out what we can and can't change, and then we work within those parameters.
Okay. And when you finish up, they get a
very detailed report. I brought one here. This is
Okay.
for a condo in Golden Gate Point. This one happens to be 11 pages, but it goes into a lot of detail about how the environment affects this particular condominium and how this person can live within it to the best of their abilities.
That's awesome. Thank you so much for joining us again today. This was most enlightening.
I love talking about anything Chinese medicine.
Okay. See you soon.
Thank you.
Thanks for watching this week's episode of Aging Gracefully. You can find previous episodes at www.snntv.com under programming. See you next week. Thanks so much for joining us.